Health experts have long said that breastfeeding is the most beneficial way to feed a baby. Yet the United Nations says that less than half of all infants are exclusively breastfed in their first 6 months. It's currently World Breastfeeding Week, and so the UN is trying to raise awareness of the issue. In this next report, we're going to take a look at France, which for years has had one of the lowest breastfeeding rates in the world.
Marlène Elmassion has a very young visitor at work today. Her 5-month-old daughter, Brune. She's her third child. Marlène still breastfeeds her once or twice a day. The World Health Organization says breast milk is the ideal food for infants, providing essential nutrients that help protect against illness. Brune also drinks formula since Marlène, a lawyer, had to go back to work 3 months after her birth. But juggling work, she says, isn't the only challenge when it comes to breastfeeding her daughter in France.
People are surprised that I still breastfeed her. I came back from hospital after her birth and was really exhausted. People would say, "Why are you torturing yourself by breastfeeding? Take it easy. Your husband should take her now." I did feel a bit judged.
Marlène says her decision to nurse, starting with her first child 6 years ago, was not an easy one.
I felt a bit alone. I was surprised when staff at the maternity hospital gave my son a feeding bottle without my consent. I really wanted to breastfeed him. It was the first sign that something was wrong.
Marlène's experience is not unusual in France. Statistics show that less than 70% of mothers will start breastfeeding at all, and the number drops to just 22% after 6 months. Experts say a big reason is France's relatively short maternity leave, just 16 weeks after a baby's birth. But the aversion to nursing runs deeper than that. Carole Hervé is a private lactation consultant in northern Paris. She helps future mothers prepare to breastfeed and helps troubleshoot when there's a problem. Today, she's advising a client over the phone. Carole says women wanting to breastfeed in France face an uphill battle because of a lack of awareness across society.
It's a great lack of support from the community in general. The healthcare professionals, to start with, don't know much about breastfeeding. So as soon as there's some kind of issue, they will say, well, maybe you can go to formula, maybe you can drop breastfeeding and use a bottle. Then the French feminists in the 70s weren't really into breastfeeding in comparison to the Swedes or the Norwegian mothers. Our mothers didn't breastfeed. So we don't have a culture that supports breastfeeding.
Despite its low breastfeeding rates, France is far from being the only country where mothers switch early to infant formula. The World Health Organization says that across the globe, less than half of all newborns are breastfed within the first hour of birth, or drink breast milk exclusively for the recommended 6 months.
And we're joined now by Amy Brown, Professor of Maternal and Child Public Health at Swansea University in the UK. Welcome to DW. We saw in that report that France has some of the lowest breastfeeding rates in the world. Can you tell us why do women not breastfeed?
I think a lot of women want to breastfeed and would really like to breastfeed their baby, but when their baby is actually born, they find that the support just isn't in place for them to be able to do so. I mean, breastfeeding is obviously very, very natural, but that doesn't necessarily mean that it's easy. So without the support system around you, whether that's support with practically latching your baby on or broader support around caring for your baby and going back to work, then it can be really, really challenging. And a lot of women are then stopping far, far before they're ready to do so.
So support is a huge issue here. But of course, breastfeeding culture differs around the world, doesn't it? Can you explain to us why that is and how that works?
Very much so. Different countries really have very different attitudes to breastfeeding, both in terms of how normal they think it is and how likely you are to see it amongst your friends and family. So if you have a culture that is really supportive of breastfeeding and it has really high breastfeeding rates, then it's much easier to breastfeed your baby because everybody around you is likely to be accepting of breastfeeding and they know what to do when you've got a problem. Now, if you're in a country where breastfeeding rates are really low, then not only is the support not in place to help you with that, but when you talk to your friends and family about it, even if they're supportive of you, they don't really know how to help. So it ends up being even a bigger issue because the support isn't there and the understanding isn't there either.
The benefits of breastfeeding are clear. Do you think women don't have enough education and information about how good it is for them and, quite frankly, how good it can be for a new mother as well?
I think to some extent, then, we're not very good about talking about the benefits of breastfeeding for a mother's health in particular, but I think a lot of women really do know the benefits for their baby and they really, really want to be able to breastfeed. It's just that the circumstances that they're trying to breastfeed in are almost set up against them. It's like we tell them that breastfeeding is really good for them and their baby when they're pregnant, and then their baby's born and the support that is needed for them to carry that out just isn't in place. So I don't really think it's a case of telling women how great it is. It's more really a case of telling everybody around them about how important it can be to a mother, not just for health reasons, but because it's something she wants to do. It's how she wants to care for her baby.
So from what you've been saying, what's needed most to encourage more women to breastfeed is support, I presume, right at the beginning when the babies are first born, but also in the months after that?
Absolutely. I think we just need a really big investment in supporting breastfeeding, but also supporting mothers more generally through those early months of having their baby. So if they are better supported, if they have better maternity pay, if they have longer maternity leave, then the whole experience becomes a lot easier. I think we do need direct support for breastfeeding, but we also need better support for mothers and motherhood in general and just that really challenging experience of becoming a new parent. So I think if we looked after our new mothers better, we'd actually see our breastfeeding rates rise too.
Such an important topic. Amy Brown, Professor of Maternal and Child Public Health at Swansea University. Thanks so much for talking to us.
I'm very pleased to welcome Gráinne Maloney, Senior Nutrition Advisor at UNICEF. Like the WHO, UNICEF recommends exclusive breastfeeding for the first 6 months of a baby's life, but many women stop before that recommended time is over. What are the most common reasons for that?
Thank you so much for having me today and for highlighting this really important issue during this World Breastfeeding Week. Yeah, so breast milk and breastfeeding is the ultimate silver bullet for public health response for children. It protects against all forms of malnutrition, and it also is a vaccine for babies, and it also has an impact on women's future risk of health, as well as it reduces the risk of diabetes and obesity, and it's even good for the planet. So we actually have amazing evidence to show this is the best thing for our infants. But as you really showed well in that program from France, it's not easy. So the first thing to acknowledge is that the majority of women actually want to breastfeed. Over 95% of infants globally are breastfed, in fact, at some stage in their life. But those numbers drop off. And the main reasons for dropping off are, number one, access to skilled counselling. It's great to hear of this persistence of this woman in France, but actually breastfeeding can be difficult. And if a mom does not have the right support either before she's had her baby and then as soon as the baby is born, it can be very difficult and frustrating for her if she has a baby that's awake all night crying and the baby may have colic and she's feeling frustrated and she's getting pressure from family members to say, as your example, to say, just give a bottle. That's really difficult. But we know that women who do have access to skilled counselling, they do well and they're much more likely to continue breastfeeding. So that's the first. The second, again, as you articulated well, is the lack of family-friendly policies, making sure that employers do allow women the time they need to have their maternity leave, then to breastfeed exclusively for 6 months and up to 2 years, allowing them access to breastfeeding rooms in the workplace, flexible working hours, and of course, quality childcare. And then a big one that is to blame too is the behaviour of the formula milk industry. This industry constantly looking at their profit margins, are drip feeding to mothers the benefits of their product, the superior superiority of their product over breast milk, and then questioning mothers and making them feel not empowered to continue their breastfeeding journey. So there's many different reasons, but they would be the major three ones.
Now, Gronya, I just want to ask, what is UNICEF doing to help improve that situation and provide that kind of support needed?
So we work in close to 200 countries around the world. We work both in high-income countries and in lower and middle-income settings to work with governments as our main partner to protect, promote and support breastfeeding. So when we talk about protection, that's legislation to pass laws on the marketing and promotion of breast milk substitutes that I mentioned earlier, but also to help governments pass laws for family-friendly policies so that women can actually continue their breastfeeding journey. We also work with governments to make sure...
I'm afraid we're going to have to leave it there, but I want to thank you so much for talking to us about this really important issue. I'm afraid for time reasons, we're going to have to jump out. But thank you again for joining us on DW News. Really appreciate it.